Hello, my name is Dr. Kerry Kalis. In this session we're going to talk about laser resurfacing. Laser resurfacing on the face has several useful applications. Firstly, with respect to facial wrinkles, it can result in a 50 to 70% reduction. Deep lines on the face achieve less impressive results and only about a 50% reduction. Laser is best suited for treating fine lines, and we see a 70 or even better % reduction. Laser can also be used to treat scars, but the results are somewhat variable. It can be used to treat pigmentation with caution, and it can also tighten skin, so it will shrink facial skin, therefore treating skin laxity. It is necessary before any procedure to be prepared. You must not drive a vehicle or operate heavy machinery for 24 hours after your operation. You should organise transport home from the facility where the procedure is performed, other than using public transport. A responsible adult should stay with you for the 24-hour period post-op. Do not sign any legal documents or make important decisions for the first 24 hours after your procedure. Here are some examples of skin resurfacing in a partial treatment. The area treated in this case was above the nose and under the eyes. You can see the result on day 1, which looks somewhat scary. At day 3, most of the skin has healed. Day 5, continual healing has taken place, and less crusting and weeping is present day by day. Here is a full face erbium resurfacing procedure. There is generalized crusting and oozing over most of the face. Each day, Vaseline is applied to the treated areas, and less weeping and crusting will result to a complete healing by about 7 to 9 days. Here are some examples of laser resurfacing before and after. Note in this case the wrinkles around the mouth and on top of the lip have been improved by about 70%. This is the same patient. In this case, full face laser resurfacing was done. The skin in the post-op picture on the right is still a little pink. This can take up to 6 weeks to resolve. A lot of the pigment has been eradicated, and also there is a marked reduction in lines and wrinkles on the facial skin. Here is another example of full face laser resurfacing with a significant reduction in lines and wrinkles over the cheeks. Once again, laser resurfacing before and after pictures showing substantial reduction in lines and wrinkles and an overall improvement in the skin texture. Here is another case taken on the oblique view showing at least a 60% reduction in lines and wrinkles around the mouth. Again, before and after laser resurfacing, improvement in the overall skin texture. This is a partial treatment showing the upper lip only. And you can see the progressive healing at day 4 and day 10. This patient has quite marked sun damage and lines and wrinkles, etc. on her face. After the operation, about a 70% depletion in lines and wrinkles, and in this slide showing a nicer, smoother complexion. Here is another example of laser resurfacing before and after, and the oblique angle showing a reduction of lines and wrinkles, etc. This case shows even more clearly the improvement that can be had with laser resurfacing, with significant lines and wrinkles over the cheeks in the left-hand image, with almost 80% reduction in the right-hand slide. What should we expect after laser resurfacing? Take 10 to 14 days off whatever you're doing. Keep your visitors to a minimum in the first week because the appearances are rather unsightly. Residual redness can persist for up to 3 months. Sometimes we need to add a little cortisone to help eliminate the redness from the facial skin. There is often swelling for up to 10 to 14 days. We recommend occlusive dressing such as Vaseline to be used until the crusting and weeping stops, and when the skin is totally healed. We do not want the skin to scab at all. This will result in delayed healing and scars. It is essential to use antiviral and antibiotic medication when necessary. There are risks, of course, with laser resurfacing. There can be wound infection. There can be painful or unattractive scarring. Pigment may increase or decrease. There can be persistent redness, skin sensitivity, pain and discomfort, visual disturbance, blurred vision. This is very rare, of course, and infection with the herpes virus may lead to scars and delayed healing. This is rare if antiviral medication is used as prescribed. Risks of surgery also involve risks of general anesthesia. There can be drug reactions, allergies, prolonged nausea, and respiratory problems. Your anaesthetist will detail these risks with you. Thank you for taking the time to listen to this presentation. Please don't hesitate to contact either myself or my staff should you require further assistance.